ambulance. I have a red card here. What number? I ring 112. Okay. Hello. I put on speaker. Okay. My name's Sean. I'm here in Farm Gorse Bridge. A friend of mine is unconscious. He's not responding to me.
Okay, Sean, I have some questions to ask you now.
Okay.
So, we're going through them one by one. What's the phone number you're ringing from?
Right. It's 087 9268 322.
Okay, what's the exact location of the incident?
I have the air code. It's here.
Please,
It's RA95YA33. We're okay. Listen, I just came on him. He's here in the shed. He's unconscious, lying on the ground. I tapped him on the shoulders and shouted at him, but he didn't respond to me. So I have some bit of first aid, but I don't know what to do now.
Okay, is it just one patient you have?
Yeah. He's 48 years of age. He's just one patient. I'm on my own here.
Okay, can you tell me whether he's conscious or unconscious?
He's unconscious. He's not responding.
Can you tell me, Sean, if he's breathing normal?
Okay. Just wait now. No, I'm not getting any breathing.
Okay, so what I want you to do now, Sean, if he's clear of any machinery in the area is safe, what I want you to do is get down, check for response, and start chest compressions if you know first aid.
Okay, will do. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Will I keep doing it, yeah?
First aid kits recommended by the Health and Safety Authority on the market. It's a boxed kit, and as you can see, it carries a wall bracket, especially for farms, where it can actually just slot into it on the wall anywhere on the farm. The contents of it, recommended by the Health and Safety Authority, they include some dressings, alcohol wipes, triangular bandages, some sterile bandages, plasters, a paramedic shears, some burns dressings, and some eye wash. Just enough to get you out of any situation, minor situation on a farm. It also has a little first aid advice and a CPR vent aid in the event of you needing it. These are an ideal kit and readily accessible in the event of a problem developing.
As I was putting on the flails on it, I turned around and I lacerated with my arm. I'm bleeding heavily out of the arm now, so a friend of mine is after coming along and going to give help.
Okay, so we're going to apply pressure over the bleed, right, and elevate it. In this case I have a dressing, right. If I hadn't, I could use a jumper or something to apply the pressure instead. I'm going to apply a bandage around it, right, to control the bleeding. We've already got somebody to ring the ambulance, they're on the way. So in the meantime, we're just going to apply pressure right around, keep it elevated, which keeps the pressure from going to the hand and helps to clot the bleed. Alright, so the further up it is, the better. The patient can do that for you. We wrap it around, and if the blood comes through it, we can apply another bandage over it. So once we have that done, we can elevate it, put it up here, and we can then, having completed a first aid course, you have learned how to apply a sling directly over here, an elevation sling to the area to keep it elevated. Big manage, man. Tie it off, and the elevation will help control the bleeding until we can get medical help. Here is we have a patient who has his hand caught in a baler, right? The most important thing here again with safety is to isolate the power, cause no further injury. In the event, as is likely here, that we're dealing with an amputated part, it's most important that we put the amputated part into a non-fluffy material and then into ice. The mistake at this level over the years has been that people have put amputated parts directly into ice and they've been burned. So there was no hope of reuniting the patient and the part in the future because of that act. A 8-year-old gentleman working on a farm, he suddenly has tightness in his chest and a pain down his arm, right? He's sitting down, which is the best position for a patient suffering this type of illness, where the heart does the least amount of work. We have contacted the ambulance service via the red card, told him that we have a 40-year-old male with central chest pain. He has no history of it. They have advised us to give him aspirin, 300 milligrams of aspirin, if it's not contraindicated, which in other words means he's over 16, he has no bleeding disorders, no bleeding stomach ulcers, or no allergy to aspirin. We'll give him the Dispirin tablet, which contains 300 milligrams of aspirin, chewed, because most cardiac patients get sick. And what the Dispirin tablet will do, containing the aspirin, it will stop the blood from clotting around the damaged area until the emergency services arrive. This is the advice we've been given by the emergency service. The scenario we have here is we have a patient who has been trapped under the wheel of a tractor. The learning points here are, if possible, we can move the tractor forward to release the patient. If not, the time frame involved here is 20 minutes. That's the huge time frame involved with crushed patients. Because if they can't be released within 20 minutes, because the blood vessels, the tissue, the arteries, the skin have all been crushed, they form a poisonous toxin within the body. If we release the patient at this time without boluses of medication, the toxins will travel to the kidneys and we'll end up in kidney failure. So the worst thing you can actually do after 20 minutes is release the patient without medical help.